So a question that I get asked a lot is,
Yeah,
let's say somebody is going to come in for a treatment for, we'll just use this as an example, knee pain, or they're bone on bone, and
right.
they're looking at getting, a stem cell injection. Who would you be the one, or would a nurse practitioner be the one that would be taking care of that injection? And if so, what would that look like?
Absolutely. I would be, or a nurse practitioner would be doing kind of everything from, not to be cliche, but soup to nuts, right? So I would give you a thorough exam. I would test, all your nerve roots and really talk about how the whole body's connected, that someone can be having knee pain, but it's actually coming from their back. And a lot of people don't realize that. So I would go over a lot of that. And then, depending on what I think is their biggest need, then yes, I would be performing the injection. Using sterile technique, I know how to do. I've been trained to do hip injections and knee injections, pretty much every joint that you can think of. I've been doing that for the last 5 years.
Why, why is there so much misconception of stem cells? Like, you're seeing, a lot of not good things being said about stem cells, but then on the other hand, you're seeing a lot of great things. Like I saw just the other day, how they just realized that by utilizing stem cells, they can grow another heart. I mean, that's unbelievable. I mean, and that's
Right.
actually proven. But what I'm seeing, correct me if I'm wrong, that it's almost kind of cliche. What is good has become bad, or it's like when there's good on the internet, there's always bad trying to say, and it doesn't work. And then you're seeing people walking and being healed. I mean, what's going on? What would you say? How would you answer
Yeah,
something?
I think that there's a lot of misinformation out there, and unfortunately, a lot of it's being put out by people in the field, actually, competitors doing slightly
Against
different things, right? So I think that in my experience, I mean, compared to steroids or any other treatment that's out there, this stuff really does work, and it really is utilizing, your own healing property. It's telling these dormant stem cells to wake up, and it's providing what I like to call a moat around the joint, say, that you inject, and it's saying all the inflammatory stuff stay out, and that's what these new stem cells are doing. So yeah, I think there's just a lot of misinformation out there. I think that the first generation of regenerative medicine was using bone marrow or adipose tissue, and I think that is still around, but you're still using your own cells that are, say, 50 or 60 years old, instead of using cells from an umbilical cord from a healthy baby that was donated and then sterilely used in a vial and then injected. So do you want the 60-year-old cells, or do you want the 1-day-old cells? I think most people are going to say, give me the 1-day-old cells.